Knock, knock.
Hi.
Hi, my name is Sam. I'm performing hand hygiene really quick. My name is Sam. I'm going to be the nurse performing a head-to-toe assessment on you today. It should only take about 20 minutes. Is that all right with you?
Yes.
Okay, I'm going to provide patient privacy. Can you tell me your name and date of birth, please?
Elizabeth Mullins, 12/14/96.
Okay, let me check your wristband. Okay, good. Now, do you have any allergies, food, medication, environmental?
No, none.
Okay, no allergies. And then, are you experiencing any pain today on a scale from 0 to 10?
None, 0.
Okay, so just by looking at her posture is good. She's sitting upright. Her speech is clear. She's responding to questions promptly. She appears to have good hygiene. Her clothing is appropriate for occasion and weather. I do not see any visible skin wounds, lesions, any of that sort. However, there does seem to be spots of hypopigmentation along the hands, by her knuckles and joints. Okay, so can you tell me what year it is?
2020.
Okay, and then can you tell me your name?
Elizabeth Mullins.
Okay, and where are we?
At the hospital.
Okay, and what are we doing today?
A head-to-toe assessment.
Perfect. So patient is alert and oriented ×4. Now I'm going to inspect her head. So just by looking at it really quick, her head size is proportional to her body. I do not see any skin lesions upon the face. I'm going to very quickly assess her scalp. Okay. All right, so far I do not see any visible lesions or wounds on the scalp. Hair is distributed evenly. It is soft, silky, and smooth. Can I see your hands really quick? Okay, so just by touching them really quick, her skin feels warm and dry to touch. I'm going to check her skin turgor really quick. Okay, skin turgor is good. Now I'm checking her nails. Her nail beds are pink. I do not see any signs of clubbing, and I'm going to check her capillary refill. Okay. Okay, so her capillary refill is less than 3 seconds on each hand, which is an expected finding. By looking at her eyes, her eyebrows and lashes really quick, her eyes are symmetrical, they are aligned. I do not see any redness or erythema in the sclera or around the eyes. Her eyelashes are distributed evenly, as well as her eyebrows. Now I'm going to check her pupillary reflexes. Can you look me? Okay. Okay. And then can you focus on this light or pen light for me? Okay, so her pupils constricted. So her pupils are equal, round, reactive to light, and accommodating. Now I'm going to look at her ears. So her ears are aligned and symmetrical bilaterally. She does have 2 piercings in each ear. I do not see any redness or drainage coming from the ears. Do you have any hearing loss problems?
No, no
Any
hearing loss.
environmental exposure to loud noises?
Nope.
Okay, do you wear hearing aids?
No.
And then how do you clean your ears typically?
With a Q-tip just around the outer edges.
Okay, so just can you tell me when you hear this really quick?
I hear it.
Okay.
I hear it. I hear it.
Okay, so patient responded positively to the finger rub test. Now by looking at her nose is midline. I do not see any lesions. She does not have any piercings. I'm gonna check her mucous membrane really quick. Okay, so her mucous membrane is pink, which is an expected finding. Do you mind plugging one nostril and breathing for me? Okay, and then the other. Okay, so her airway is patent. Moving on to her lips are pink, no signs of chapping on the lips. Can you smile for me? Okay, and can I see your gums? Okay, so her gums are pink and moist. Can you stick out your tongue for me? All right, and then can you say ah, ah? Okay, her uvula rose and fell, which is good. And then can you lift your tongue up to the roof of your mouth? Okay, so patient's frenulum is midline. Her mucous membranes and gums are all pink and moist. Next, can you move your head side to side for me? Okay, and then up and down, please. Okay, so her head and neck range of motion are good. I'm going to move on to her upper extremity very quick. So can you move your shoulders good, and then your elbows, wrists, and fingers. So her range of motion in her upper extremities are good. I'm going to test muscle strength really quick. So yes, can you go up like this for me? Can you pull? All right, then push. Good, and then same with your shoulders, resist me. Good. So patient's muscle strength in upper extremities are 5 out of 5. Let me just test one more really quick. Can you resist? Okay, and then perfect. So patient's muscle strength is 5 out of 5. I'm going to check upon her skin really quick, just lightly palpating. So her skin is warm and dry to touch. I do not see any lesions or wounds. Next, I'm going to listen to your lungs very quick. And just by looking at her breathe throughout this assessment, I noticed that her breathing was quiet and effortless. So I'm going to auscultate really quick. Okay, and before I do that really quick, I'm actually going to palpate your radial pulse. I'm gonna get my timer. Find her radial pulse very quick. All right. Okay, so patient's radial pulse was 73. I'm just gonna check on both sides just to make sure that they are okay. Let me just do that one again really quick. Okay, so patient's radial pulse has a +2 amplitude, rather regular rate and rhythm bilaterally. Now I'm going to listen to your lungs really quick. I'm going to listen through on top of her shirt just to provide her privacy during this video. Now can you take deep breaths in and out each time I move the stethoscope? Okay, just from her anterior lung sounds, they are clear. No presence of crackles and no abnormal lung sounds. Now, do you mind tilting just a little bit this way? I'm going to listen to her posterior. Okay, take a deep breath. Okay. Okay. Okay, now I'm going to listen to them laterally. Do you mind lifting your arm up really quick? Okay. Okay, so once again, her airway, I do not hear any abnormal lung sounds upon auscultating. Next, I'm going to check her heart. So I'm going to listen really quick. Okay. Okay, so S1 and S2 are present. Now I'm going to find her point of maximum impact, which should be within her fifth intercostal space, midclavicular. So I'm going to find that really quick and auscultate for 1 minute. Okay, so let me find your clavicle. Okay, so it should be right about there. Okay, so patient's apical pulse had a regular rate and rhythm. Okay, now I'm going to assess your abdominal area. So if you mind lying down for me really quick. And I'm going to use this blanket to provide extra privacy. Okay, thank you very much. Perfect. So just upon looking at it, her skin color is even throughout. She does have a umbilicus piercing and her umbilicus is midline. I do not see any pulsations when she's lying down. So I'm going to auscultate the 4 quadrants starting in the right lower quadrant.
Sorry, I'm
No, it's
really
alright. Push down where I'm pushing down just to. Good. Okay, I'm going to move up to the right upper quadrant. And I heard about 12 vowel sounds in the right lower quadrant. Okay, so I heard about 15 sounds in the right upper. Okay, moving to the left lower. Okay. So I heard about 13 in that quadrant. There are active vowel sounds in each of the 4 quadrants, which is a good finding. Now I'm going to lightly palpate your abdomen. Let me know if you feel any tenderness, okay? Okay. Okay. All right, do you mind moving your hand for me really quick? Sorry about that.
It's okay, I'm sorry, I'm ticklish.
It's all right. It's all right. Okay, just no tenderness then, just ticklish?
Yeah, it's not tender, it's just ticklish.
Okay. Now moving to the left lower. Okay, no tenderness, correct?
Correct.
Okay, so next I'm going to ask you to sit up really quick. I'm going to remove this blanket. I'm going to assess her lower extremities, so just by looking at them really quick, I do not see any visible lesions or wounds. Once again, there are little spots of hypopigmentation. I'm going to lightly palpate really quick. Okay, so her skin is warm and dry to touch. Do you mind lifting up your knees for me really quick? Okay, can you kick your legs out? All right, and then can you move your ankles around? Okay, and then wiggle your toes. Okay, so patient's range of motion in her lower extremities are good. Next, I'm going to test her muscle strength. So can you scooch up on the couch a little bit? All right, perfect. I'm gonna want you to lift up and resist me trying to push down, okay?
Both?
Yes, both.
Okay.
So lift up. Sorry. Okay, and then push down on me while I'm trying to pull up. Okay, good. And now, I'm gonna try and pull your legs out. You're gonna resist me. Good. And then I'm going to push in, resist me. Okay, and then I'm gonna have you lift one foot up at a time and then resist me pushing up. Good. Here too, resist. Okay, now I'm gonna try and push down, resist. Good. Resist. Good. So patients' muscle strength for lower extremities are 5 out of 5. Now I'm going to ask you to, can you remove one sock for me? I'm going to palpate your dorsalis pedis. Sorry about that.
No, it's okay.
All right, so I'm going to find her dorsalis pedis pulse. Okay. Now I'm going to palpate that for 30 seconds. So I got 62 beats per minute. So you could put your sock back on if you like. Okay, so now the assessment is over. I'm going to lower the patient's bed all the way down, put the side rails up if needed. I'm going to place the call light near her. Now, Elizabeth, is there anything that I can do for you right now?
No.
Okay. I'm gonna be back in about 1 hour to check up on you, all right?
Okay, thank you.
Okay, no problem. So I'm going to perform hand hygiene as I exit her room.